Hey guys, Dr. Stiffy again. I did a video on a patient's lower back last week or so, and we've got a lot of good feedback, and I had a lot of different people asking me questions, and so I was going to do another one today on knees. We work with a lot of knee pain patients here, and most of the time, unfortunately, when they come to our office, they've already been a lot of other places. Many of them are already been told that they're bone on bone, and their only option is a knee replacement. Well, obviously, most people want to try to avoid that if they can, and most of the time we've been able to help patients avoid that. Obviously, sometimes that's what they need, but if we can avoid it, that'd be great. And so I was just going to show you a couple x-rays of what a normal knee looks like, and then one of our recent patients that we've been working with for a couple months, and he's back to almost pain-free and using his knee just like he did 25 years ago. And he's been in pain for about 25 years. So it'd been easier to get him better if he came in 25 years ago, but obviously that's not always the case. But let me show you this normal knee here. So hopefully you guys can see this. But so right in here, we look at the space, and that's where your meniscus is. I'm sure everyone's heard of that, but that's the cartilage between your knee joints. And so we want the space to be nice and open and about even on both sides. That's what we're looking for. We want their kneecap or your patella kind of right up here in the middle. That's where it should be. It should be kind of right in the middle. And then the two lower bones, the bigger bone is your tibia and the smaller one is your fibula. And so you want a little bit of a space through there, about a ½ inch to an inch or something like that on the x-ray. Otherwise, that'll show us that your lower leg is twisted. Okay. Okay, so then this is one of our patient's knees. And so as you can tell, we first look at the space, and this is outside of his knee. So he's got some space there, but here on the inside, there's almost no space there. That's pretty much bone on bone right there. That's really worn down. He's even starting to get some bone spurs over here. That's been a problem for a long time. You can see up here his kneecap has drifted out to the outside. That's very common with a chronic knee problem. Many times this muscle on the inside up here and in your quad gets very weak over time, and that also lets your kneecap kind of drift out to the side. So then basically every time you walk, it's rubbing on this inside right here. So then also, we look down here at the lower leg, and so the tibia and the fibula, there's no space there now on this one. So his lower leg, his tibia has twisted, and it's putting a lot of torque on his knee, and that's what's causing this to be such a problem up here on the upper part of his leg and knee. And so basically what we do like a series of adjustments. We use our cold laser. We actually have a knee decompression machine that works really well. We also have several other things that we can do that really help with knee pain. I don't know how many we've worked on now, probably well over 1,000. We've been doing this for a very long time. I've always had knee problems myself, so I've always learned a lot about working with knees. And so anyway, if you have any problems or you'd like us to just check you out and see what we could do, give us a call, and we'll be glad to check you out. Maybe we can help you.